Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'm going to discuss jawline rejuvenation. This discussion often starts when people, both women and men, but mostly women, come into my office and they pull their cheeks back, giving themselves a mini temporary facelift. They say their face is falling, it's sagging, they hate their jowls, and when this is the main issue for the patient, I start the consultation by stating that there is nothing non-invasive that is going to give them that much pull. We look in the mirror together and I explain that those results of pulling the cheeks that much are surgical. And so I would like to start this podcast the same way. If you are looking for a tight pull of the cheeks up and back, I recommend discussing this with great plastic surgeons, getting 2 or 3 consultations before deciding about anything. But if you are not interested in a facelift with a plastic surgeon, then this is a good podcast for you. There are many ways to improve the jawline non-invasively. Today, I would like to cover fillers, Ultherapy, and Ellacor for use in tightening of the jawline and reducing the jowls or pre-jowls. There are other similar devices that may be used by other physicians, but I'm going to discuss the main choices that I have in my office. And there are also separate podcasts in each of these, so listen to them if you want more information on fillers, Ultherapy, or Ellacor. First, let's talk about fillers. Volux was FDA approved for jawline rejuvenation recently. Before Volux, many of us injectors did not really think about putting filler in the angle of the jaw or along the jawline as much. But Volux does work well for many patients to give that angle of the jaw, below the ear, more volume, and that can help pull the skin back a little bit and reduce jowls. Also, Voluma or other cheek fillers can help lift the cheek up a little bit. Voluma has been FDA approved for around a decade, and often the combination of both jawline and cheekbone fillers can help make a few millimeter change, which is what we are looking for. I also very commonly use hyaluronic acid fillers in the chin area in front of a jowl and in the nasolabial fold and corners of the mouth and chin to help support the whole area and minimize the appearance of a jowl or a pre-jowl. And this technique works really well. When I'm working around the mouth, I like to use soft fillers made of hyaluronic acid, really of any brand. So we're talking about Juvederm, Restylane, RHA. Fillers of any kind are done in a quick office visit, and the main side effect is a bit of bruising and occasional bumpiness. And there is a whole podcast on fillers if you want more information. I would like to mention here that I do get a lot of questions these days about Sculptra, which is technically not a filler, but gets lumped in with fillers since it is used in the same areas of the lower face and can offer similar results. Sculptra can be helpful to create volume and potentially give a bit of a lift, but I just prefer hyaluronic acid fillers due to the fact that if a bump occurs, it's much easier for me to reverse it than if it's a bump from Sculptra. But Sculptra can work well in these areas also. Second, I would like to discuss Ulthera or Ultherapy, which is a deep ultrasound treatment that is FDA approved for skin tightening, and there's a whole episode on this if you want a deep dive into it. Ulthera is the name of the machine, and Ultherapy is the name of the treatment, but the words are often used interchangeably. Ultherapy has been around for a while, and we often treat the jawline or the lower face, including the jawline, to get some lift. I find this works best on patients with thin skin and a small amount of laxity, so just a little bit of loose skin. If someone needs a facelift, Ulthera is not a good choice. They will be disappointed, and so I will not book that patient for Ultherapy. If the patient is a good candidate for Ultherapy, then the main downside to consider is that it hurts when it's being done. It is technically a no downtime procedure. Occasionally someone gets a bit red and swollen from it, but it's usually pretty minor. Once every few years, I see somebody get a bit bruised, but that is very uncommon. For jawline rejuvenation, I will often have the patient do the Ulthera first, since the results can take 6 to 9 months for full effect, and then follow it up with fillers. The reason that it takes so long to see the results is that Ulthera burns holes underneath the surface of the skin, and then the body needs to heal that microtrauma and grow new collagen, and that takes a while. For a more aggressive result than Ulthera, I will often recommend Ellacor. Ellacor is relatively new. It's been around a few years. It's a skin coring device, so it removes tiny pieces of skin and thereby gives an immediate small lift and also causes lots of microtrauma and stimulates collagen and elastin to grow. Ellacor is FDA approved for the lower face. The main downside of Ellacor is that it looks pretty bad for a few days, so I tell people they need to clear their schedules for a week. And some patients can even have some persistent redness past the 1 week mark. There is a whole episode on Ellacor if you want to listen. Scroll back and find that one. I will often choose with the patient between Ultherapy and Ellacor if they are good candidates, and I recommend to do that first and then follow up with fillers. The combination is usually the best results, and then, of course, we have to touch these things up over time and repeat as we all continue to age. That is also true of a facelift. It does not last forever. You'd have to ask the plastic surgeons, but I think they can last up to 5 to 10 years or so, but some people do need repeat facelifts over time. I'd like to take a moment to mention something that I get asked about a lot for jawline rejuvenation, and that is Botox. I am just not a big believer in seeing great results from injecting Botox along the jawline and having it relax muscles there and tighten the skin, so I really just don't do it because I don't think it does much. Some people refer to this as a Nefertiti lift, and it was popular years ago, but again, I don't think it does all that much, so I didn't continue doing it. I prefer to stick to things that give visible results, and I just don't find that Botox is my favorite treatment in that area. There's certainly nothing wrong with doing that. I just don't think it does a lot. So, in summary, many people feel that their face is falling and that they do not like their jowls or pre-jowls and they want it fixed. For aggressive treatment, please see great plastic surgeons, always get more than one opinion, and do your research. For non-invasive improvements, or tweakments as I like to call them, for patients who have mild issues and do not need or want surgical intervention, I do get great results with a combination of skin-tightening treatments such as Ultherapy or Ellacor, followed by fillers either in the cheeks, jawline, chin, or around the mouth, depending on their particular issues. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.